موجودة هنا؟
stoppers.
ايش وظيفتها؟
Stops.
ستوبس.
It's not called stoppers.
ستوبس.
It's called stops.
ايش الفانكشن حقها يا شباب؟
Stabilize.
ستابلايز. واحد.
orientation.
اورينتيشن جايد. تمام. ثيرد وان ايش هو؟ to maintain
Space.
yes to maintain the space.
Uniform
عشان-
thickness.
ايوه يونيفورم ثيكنس عشان تعمل الامبريشن ماتيريال ثيكنس يونيفورم ثيكنس واحد ما يكون زياده محل وناقص من محل. طيب في عندنا هذا اللي هو الادهيسيف ماتيريال. هذه ماتيريال راح نحطها على السبيشال تري تمام عشان تمسك الفاينل امبريشن ماتيريال يمسك مع التري تمام. طيب عندكم هذا
We'll start with placing that.
اوكي
See, when your patient walks in on the day of your impression making procedure, what you're supposed to do is first you'll get this from the lab. You will first check it for anything that is rough. Okay. Now we need to check the extensions in the patient's mouth. So we will check the extensions in the patient's mouth. We see that nothing is injuring or impinging on the tissues. All right. Once we are fine with this, patient is comfortable. Patient can lift their tongue. Everything is comfortable for the patient. They should be able to because what is the extension for this? 5 millimeters from the free gingival margin. It should not even go to the sulcus. All right. So if everything has been made properly, after we test that, we take it outside, we wash it because saliva will be there. We wash it, dry it, and then we apply the tray adhesive. So when you're applying the tray adhesive, you can do that. Okay. Don't apply too much, thin coat, and then you have to leave it for around 12 minutes. All right. You leave it for about 12 to 15 minutes minimum. You can leave it for long, no problem. All right. So please watch. He's applying a very thin coat. Don't apply too much. You can apply on the margins, on the outer side also. Don't apply it everywhere else because it will stick to your gloves. All right. This is to stick rubber materials. Okay. So
This is to stick the impression to the tray.
now, ideally, your tray. Can I have a look at your tray? Ideally, your tray is supposed to have a lock. All right.
Yeah.
Which is formed by what? We had the
2 lines.
yes, the wax was here, and we had the tray till here. So when the tray is here, it goes and touches. It creates a lock. So if you feel this here on the inner side, there should be a lock. Some of you have happily trimmed it off. Okay. Yani you'll pay the price for that. Okay. So you're supposed to have. That's one way of getting your attention, so that the impression doesn't come out. And this is the other way. It sticks to the tray. If an impression is made where the impression came away from the tray, this is a failure. You should repeat it. All right? It should never come. The impression should never come away from the tray. It should be firmly with the tray. Any impression, primary impression, master impression, any type of.
Alginate impression.
Yes.
Come out of the what? Sorry.
If it comes away from the tray, it's a failure. You have to make another one. All right? Now, the next thing. So you're leaving this for
12 to 13.
minimum 12 minutes outside, air drying. So the next step.
طيب احنا مع جو يا شباب عشان
So
أوريكم.
anybody got
جو
Please get a job.
ليه؟ اوكي مسوي فيه. حد يعرف ايش هذا يا شباب؟ كراكشن. تمام في مقاسات منه طبعا يا شباب. اوكي طبعا لما حنحطه على الجنجبه تمام حنبدا من الميزيال او الديستال بروكسيمال لان عندنا البوكيت والبروكسيمال احسن من البكل واللينجوال او سواء بكل وبلكي فاسهل لنا ايش نحطه في البروكسيمال سايد. طيب
Why do we start from the proximal?
Because the pockets is pockets.
So you take a measured quantity as he's taking here.
طبعا ما بتاخذ زياده ولا ناقص المفروض على قد اللي حنشتغله تقريبا.
That doesn't cut like that. 1 second. Let me hold it tight.
Doesn't have a cutter inside.
Old school.
شوفوا يا شباب الباركة بالطريقة هذه هنا فاتح الكونتاكت.
Zero.
You know the
شو اسمه هذا؟
sizes?
Plastic?
لا مش بلاستيك هذا.
What is this instrument called?
شو اسمه؟
شو اسمه؟
That's what I just asked.
يبدأ بكور.
What is the cord he's holding? It's a refraction cord, right? What is he doing to it? What is he doing to it?
انا ايش عم اسوي يا شباب؟
He's packing the cord. So it's a cord
Packing.
packer. خلاص. It's no brainer. Okay?
اوكي.
Now, just to show one thing. When you are packing the cord, first you start from the proximal side. While you are moving, I'll slightly pull it outside so that I can show you something here. While I am packing it inside, I'm going to always hold the cord packer in the direction of the cord that is already packed. If I hold it like this and I poke it, and I poke this side, that side will come outside. Common physics, all right? So I will have to hold it like this, and I will pack it into the gingiva now. Now here, unfortunately, this is the reverse way of how it is in the gingiva, where we have more play here and less play here. But anyhow, so you will be packing it like this. Some of you can rotate it in also. This is also a nice way to get it in. But always the angulation will be towards the tissue, towards the part which was already packed. All right? So you'll pack it like this, and you'll go all the way around. How long do we leave the cord inside in the sulcus? How long?
Long time يا شباب.
Time.
maximum 30 minutes.
30 minutes.
30 minutes.
5 minutes.
What, you're going for coffee break to Starbucks or 30 minutes? Huh?
That's
5 minutes.
5 to 10.
We are going to leave it for about 7 to 10 minutes because we want a thing called transient retraction. We don't want it to stay like this for the rest of its life. We want it to come back. We want the tissue to come back. So if you want the tissue to come back, 7 to 10 minutes. If it's crossing 10 minutes, please take the cord outside. All right? So if you keep it for longer, what happens many times you might land up with some amount of gingival recession. So usually 7 to 10 minutes. Now in the 7 to 10 minutes, this is being anyways sitting over there. We've kept this here. We have everything ready. You can ready your gun. You want to talk? You've already given them the demo. Everybody has seen this gun. I'll just quickly go through the gun part again. Everybody has seen these guns. It has a notch here. It has a depression here. It has to fix this way. It cannot fix the other way around. Right? It will not fix. This will not close. So you need to fix it this way. Lock it. Now, if it has already been used, like for example, this one has already been used. If it's a used one, you press it like this. Press the lever here. Push it in. We're not going to use this because it's too little material, but you should press it and keep it there so that you're not wasting time. Otherwise, you'll be sitting, he'll be injecting, I'll be doing this, and nothing is happening. All right, so you should be keeping it ready for function. If it is a brand new one, you don't need to push this one, but what you need to do, could I have tissue paper please? Tissue paper. What you need to do is you need to inject and dispense some material. The reason for injecting and the reason for injecting and dispensing some of the material is, yes, you should have an equal flow from both the cartridges. Now, you will see when I inject it, this is a brand new one, you will see that there will be some kind of an oil coating, and you see one is coming out before the other one, right? So, till the other, can you see that oil coating on that?
Yes.
That's kept so that it doesn't dry up or anything like that. So, now I have both coming out equally. I'm ready to use this one. This one is, you can test this one also. No, something wrong with the material. Okay, good. Now, in addition to this, let's put this away. You have to be very careful with this material. If this gets onto the fabric of your fabric or the patient's fabric, it will not come out. Will not. Forget it. Okay? So, inshallah, someday you'll be having a very high-end clinic. Patient will be wearing Gucci and Prada, and then you will be paying the patient for the crown. Okay? Because the crown will be nothing close to the shirt that they're wearing. So always keep this away. Now, you have two different colored tips. One is smaller, one is thicker in the bore. So which one do you think I'm going to use? You know the difference in these two materials?
Yeah, this is flow, more flow one.
This is heavy and light.
Thank you very much. This is the light viscosity. It's written over here, light bodied consistency. This is the heavy bodied consistency. Alright? So which one will I inject in the mouth? Not in the mouth, around the tooth.
Light.
The light. Which one in the tray?
Heavy viscous.
Which one will I use for the heavy? Which one will I use for the light?
Big one.
Common sense.
Don't need to ask you too many questions. Here, you can fix this one there. Yeah, we're going to use the one which has an extra tip. Why do we need this tip? You can direct it. We just did a retraction. So we have a finish line and we have this gingiva retractor. We want to inject material right in that sulcus. All right? So we need to have that tip so that we can dispense it all around into accurate area. You can fix that there. Lock it. Very important. We've had some incidents where the person doesn't lock it, and then while you're injecting the material, especially this one, when you're injecting the material, this tip falls outside and the material falls on the patient. All right? When you have a patient who has a nice beard, okay, and it's always better to apply a bit of Vaseline. Don't put too much, a little bit of Vaseline on their beard. Otherwise, if material falls on it, you'll spend 10 minutes to make the impression, 45 minutes to remove this addition silicone impression material. Right? If you put Vaseline, and also if the material falls on the beard or on the face or anything, don't go and rub it immediately. All right? It'll spread it. Let it set. Give it 5 minutes. Let it set. After it sets, you'll just peel it off. Comes off easily. All right? Even on the beard. Don't spread it and make it part of the beard, and then you try to remove it. You can sit with the shampoo and then clean the patient's beard for the next. You can become a barber. By the way, initial dentists were all barbers. You know that, right?
Yeah.
What do we have?
So, be careful of the heavy body, because if you have a lot of undercuts in the patient's mouth, it will stuck inside. The tray will not come out. You can forget it. You have to section your impression and the tray to remove the impression. So you only use it when maybe you don't have the regular body, or if you know that the patient doesn't have a lot of undercuts, or in cases of complete denture.
One more question. This is a custom tray. Do we use putty material in a custom tray? Yes or no?
Yes.
No. The answer is no. They all kept quiet. All right? Never use putty material in this. We want our final impression, and oh, somebody sectioned this. Okay, we want our final impression to have light viscosity on the tooth which we have prepared. If I use a putty material, it's very thick, it will push all the light viscosity away. Also, it is confined, so it will definitely push the light viscosity. So always in a custom tray, we use the medium viscosity or the heavy viscosity. Around the tooth, light viscosity. In a stock tray, we use the putty consistency. All right, and the technique is different. Here we are four-handed dentistry. You have a clinician, you have an assistant. All right, so the assistant will deal with the tray, the clinician will deal with the tooth. All right, do we have a tooth preparation? We'll use this. It's okay, it's fine. All right, so the clinician will work on the tooth, and I as the assistant will work on the tray. When we are four-handed dentistry, it's called four-handed dentistry. If you're using putty, you can do two-handed dentistry, and the technique is different. I've already given the lecture. You have a single-step double mix. That's what we're going to do here. Two mixes, light and heavy.
In one step.
In one step. You also have a double step and double mix. All right. So two mixes and two steps. All right. Also called putty wash. When you are injecting the light viscosity, he'll tell you something about that.
Doctor, you have to avoid the bubbles.
That's what he's going to talk about now.
طيب يا شباب، لما نحط اللي هو اللايت بادي تمام يا شباب، كمان نفس الفكره حنروح من ناحيه البروكسيمال ديستال وميزيال، حنسوي بوش للماتيريال بهذه الطريقه. تمام، لو سوينا له بوش كذا بهذه الطريقه ممكن في احتماليه يصير في بابلز، فبالطريقه هذه بهذه الطريقه خلي الماتيريال تصير لها فلو من الميزيال والديستال، بعدين نكمل على البكر والبلاتر. تمام، طبعا حنكون انكلود معانا الاوكلوزال سيرفيس حق الادجيسنت. تمام، بس
Okay. Wait 1 second. And when you're injecting the material, this is all parts which you should take into consideration when you're injecting the material. When you're injecting material into the custom tray, all right, don't hold it like this because you feel this is easy and start injecting and then going like this into the material. What happens with this is you're going to get a lot of material over here. It's going to become a mess. All right. How much material do I need to fill this whole thing with this? Why? It's too much excess. you have to understand one thing, that this jaw is going to go inside this area. How much spacer did we give? What is the thickness of the spacer?
2 milli.
2 millimeters. You put 2 sheets of wax, 2 millimeters, right? So 2 millimeters. So if I fill this, that's too much. I don't need to fill this. I need to inject just enough so that it's covering that 2 millimeters of space, and maybe a little bit more. So what I'm going to do is, don't inject it like this and go like this, because it's going to mess up the whole area. It's very sticky. Hold it like this and inject it, and have a continuous flow. Don't start from here, then start from here, and then try to connect it in the middle. You might get an air bubble somewhere. So you have a continuous flow. I will show you how that's going to be injected, and then you can make a trough or a slight depression in the center area where the jaw is going to go, the teeth and the jaw is going to go. So now, while we are working, you can pay attention to what we're doing. Maybe somebody can shoot some of that part, some of this part, and then you can, anyways, you're going to shoot this video together. Just to show you, so this is your tray. I'm going to use the one which we use, the tray adhesive.
Where?
Oh, one more thing, when we're injecting, we're always going to inject simultaneously. If he's doing a single tooth, I have to start injecting faster. Whereas if he's doing multiple teeth, I might even wait. If he's doing 4 teeth, he might finish injecting for 2 teeth, and then when he starts with the third tooth, he will tell me, okay, start injecting. Then I'll start loading my tray, because we want it to set at the same time.
Okay, doctor.
Since it's a single, we're going to start. Release it completely, and then inject.
دائما يا شباب خلوا التب لامس بالسن، تقلل احتمالية انه يصير في بابلز. هلا حنوصل الكروزر.
You don't need, I'm just making a slight trough, yes, a slight trough in the center. I don't need to have too much of material. This itself is a little excess, but I'm going to keep that as a safeguard so that I definitely have my impression clear. All right? And then, as a clinician, I will pass this to the clinician. He will place it. Now, your stops had some functions, right? Stabilization or stability, orientation,
Thickness.
okay, and maintaining thickness. Now, if you've made your stops properly, you don't need to think. You cannot see where you're placing the tray. You just need to press it into the patient's mouth. These stops are site-specific. I'm just going to be careful with this. These stops are site-specific. If you made it on one tooth, it has the anatomy of the occlusal fossa here. So it will go exactly into the same space. So when I press it, it goes into the 4 spaces that it was located at. It will not move. It cannot move. So stability, orientation, and it's maintaining the thickness. So please don't go around trimming your stops. Stops are made according to the anatomy of the occlusal aspect. If it's on an edentulous ridge and you're making a complete denture tray, supposing I have a ridge, anterior thin, posterior thick, I have a stop in this area. If I move it slightly, and if I move the tray slightly anterior, what will happen?
It will stick.
It will be moving around. It's not stable. If I press the tray, it will go to the final seated position. So it maintains orientation and stability. How long do you think this material takes to set? Yeah, depends on some companies. Now here, this is a regular setting material, which is around 5 to 6 minutes. You have also a quick setting material, which is around 2 to 3 minutes. Okay, you need to be fast. All right. Now, why have I injected this material over here? I injected something over here. This is a control. Yes, this is a control for me. All right, and I am going to keep checking this material. Now, you see how he is holding us, right? There are 2 pressures which are there. One is the seating pressure, when I put the material and I'm seating the tray, and after that you have a holding. You're not supposed to keep pressing the tray. Just keep it there. This is a rubber material. It will have a bounce. So don't keep pressing it, because you cannot constantly keep pressing the same way. Your hand will get tight, then you loosen, but while it's sitting, then you'll get a bounce, you'll get inaccuracy. So you press it completely the first time, the stops will go in contact, but you have to hold it in place for 5 minutes or 6 minutes. Most boring part, you cannot talk to anybody. You'll be holding it like this, standing with the patient. Okay. Don't talk to them. That's only for this one.
With the light pressure?
Right? just holding.
Just holding.
Holding, no pressure. Just
That's
holding.
all. بس
Right?
لا
Don't let
يتحرك.
it move around. Now, in the patient's mouth, and I'm glad that you're recording me, in the patient's mouth, never put Vaseline on the tooth or on the gingiva. Never when you're making an impression. Only when you're doing relining will you do this. Right?
So when the provisional crowns.
That's why I said when you're doing the relining, you'll put. That's why I said that. I just said that. You have me on video also.
Yeah.
Okay? I'm very careful. All right. When you're making an impression, never put any Vaseline anywhere. All right. You want the material. This is a hydrophobic material. You want this material to cover the tooth structure. If I put Vaseline, it's not covering the tooth. It's not touching the tooth structure. There's a layer of Vaseline in between. You're losing the accuracy of your fit.
But about the drying,
Now, which one?
drying the penetration.
You're going to dry it after you remove the cord. All right. Now, here, this is a rubber. The jaw has a rubber here. So there is a chance that this material will stick to it. Right? So only when you're doing the jaw work, place some Vaseline on the rubber of the jaw, not on the teeth. Only on the rubber of the jaw. That doesn't mean when you go to the patient, you're going to put Vaseline on his mucosa. Huh? You don't need to. I'm glad that you're recording this, so you have me. Because there'll be some guys in the clinic, they'll be like, oh, put Vaseline. Dr. Fernandez said, put Vaseline everywhere. Now, I think we missed out one part. It was still not set. When you're removing the cord, all right, when you're removing the cord, so that's why this video is not in flow, but you will have to put the flow. When you're removing the cord before the impression, what should you do to the cord?
You have to add a few drops of
You have to add a few drops of water to it, all right? 1 or 2 drops around the cord. Why? Because your hemostatic agent. Did you talk about hemostatic? Did you talk about that? Okay. The hemostatic agent is what you're going to be dipping this inside before you pack it. What does the hemostatic agent do? Yes, it arrests
Like
the
epinephrine.
bleeding and reduces the GCF also. All right, peripheral vasoconstriction, so there's less liquids in that area, less blood, less GCF. So it's dry. If I'm just going to pull this cord outside, it'll lacerate a couple of capillaries and bleeding will stop. Okay, so just moisten it with a little bit of water, pull it out from one side and go around. Don't pull it like this. All right, go around gently. Now what is the next step? Dry it. You have water already there. You need it dry. This is hydrophobic, right? So you dry the tooth, dry the sulcus area, then you go for the impression procedure. All right? Yes.
In patient mouth, is it okay to have a contact between the saliva and the material?
There will be contact between
So,
nothing is going to happen as long as the areas which, that's why we have an extension of 5 millimeters more. Now the excess material has come here, right? Saliva will pool over here. This is a rubber material. It's not going to have a big problem.
There is one more thing. Saliva, thick saliva, will sometimes make the material harder to go inside the sulcus area. You have to dry the tooth before injecting your material. Okay, so you removed your retraction cork, dry the tooth, place your light body, but then take your impression. Okay. You also need to take notice that it will set faster in the patient's mouth than outside.
Why?
عشان
We were going to ask them that question. Why? Body temperature. That's what we were going to ask them about this one. This material as a control, once this is set, I am 100% sure this is it. Why? As he was saying, this is going to body temperature, any material by the way, not only impression material, any cementation material, any impression material, anything else, composites, any material will set faster in the oral cavity than body temperature. What's the body temperature? Ask them some other basics, they might not know. Okay, it's set. So now we can remove it. Now this may not come off with a jerk. You're supposed to have a jerk snap removal. In the oral cavity, it does come out. You need to be a little careful sometimes when you have FPDs and stuff like that, but this will not come out like this so easily here, mainly because of the rubber sticking to the rubber.
also because it's heavy body.
No, this one is mainly because of the, see, it comes off after I do this. I need to slightly lever it. Could I have a blade? No. Give me that, please. Yeah, please give me that.
Please do.
Thank you.
It cannot second patient now.
Which one? It will not stick unless it's gotten some undercuts. It will never stick on the mucosa. Okay? It will stick only if there are, as the doctor was saying earlier, if you have undercuts, severe undercuts, it will get stuck in those undercuts. If you have, you should block those undercuts before you make the impression. Or your tray extension should never be. That's another reason why we keep the tray extension for FPDs only 5 millimeters beyond. It's coming out, don't worry. I need a blade, please. Yeah. So now we have an impression, pretty impressive. Yes, all the finish line is in light body. This is what we are going to check as an instructor for you. The finish line should be in light body. In fact, the whole tooth which is prepared should be in light body, but if a little bit of the occlusal aspect got pushed away, it's still acceptable. But the finish line has to be in light viscosity. It cannot be otherwise. If there is an exposure of the finish line with the heavy viscosity, scrap it, do another one. Right? No air bubbles should be there. Now, we still, there's an extraction socket here. Okay. We still have to do one more thing before I send this, two more things before I send this to the lab. One is all this excess, remove it. Now, I am sure that my tray extension is 5 millimeters away from my pre-gingival margins, right? Which means I can blindly, thank you very much. I can blindly just hold the blade against this tray edge and cut. I don't need to think about what I am doing. If you designed your tray well, this should be as easy as what I'm doing. Sorry about dropping it there.
So the finish line should be coated with the light.
It should be coated with the light viscosity. So I cut this off. I have a nice, clean, neat tray. All right. The material is not coming away from the impression tray. It's all stuck well, and this is my final impression. Now what do? Disinfection. So you need to add a little note in your video about disinfection. This is a addition silicone impression material. What are the disinfectants that you're going to use? I've already taken the lecture. There is a slide with all that on it. Okay, so make your video pretty smartly. All right, you can take a closer look at this. Retraction cord, hemostatic agent, retraction cord backer, light viscosity, tray adhesive, impression. Yeah, we are done.
Thank you.
So you guys are going to have to make this